Good morning, everybody. We're going to be starting the program shortly, so please grab your refreshments and take your seats as soon as you can. Thank you. Good morning, everybody. Thank you for coming out today to join the conversation and Knock Out Opioid Abuse here in Cape May, hosted by the Partnership for a Drug-Free New Jersey and Horizon Blue Cross Blue Shield of New Jersey. My name is Paul Rotella, and I'm the President and CEO of the New Jersey Broadcasters Association, and I'll be your moderator for today's town hall. I'd like to thank everyone who's in attendance for your commitment to being a part of the solution to the statewide opioid epidemic. We have a number of luminaries and special guests in the audience. I want to recognize them, but before I do, I want to recognize the most important people in the room, and that's the students from Cape May County Technical High School. Where are you guys? The hospitality program there, and Lower Cape May Regional High School, the culinary program. I think everyone would agree if it wasn't for you guys, none of this would be necessary. Thank you so much for being here and for being leaders in your community. We have from the prosecutor's office today, our prosecutor, Sutherland, is here, along with Assistant Prosecutor DeWeese. They're in the back there. And they're standing next to Chief Lizette from Middle Township, who's also the head of the Police Chiefs Association. He's the president of New Jersey Police Chiefs Association. Chief, good to have you here. From our Cape May Police Department, Detective Tolan, Detective Sergeant Walker, who's keeping us safe here today as well. We have the freeholders also, which I think it's great to have our freeholders here. It's such a nice support. Jeff Pearson, freeholder Gerald Thornton, and Marie Hayes. Thank you all for being here as well. And the Deputy Mayor is here as well, Patricia Hendricks. Deputy Mayor, very well. And we're going to save the best for last, okay, Mayor, if you don't mind? We're going to save the best for last. Well, thank you all for being here. Did I miss anybody that needs to have their name shouted out? Not yet, okay. Well, thank you all again. The Partnership for a Drug-Free New Jersey and Horizon, through its philanthropic arm, the Horizon Foundation for New Jersey, have embraced a 2-year Knock Out Opioid Abuse initiative to address the opioid epidemic through community outreach, prescriber education, parent education, and a statewide awareness campaign. This is the fourth of 21 Knock Out Opioid Abuse town halls that'll be held, one in a community in each county, all across the state of New Jersey in 2019 and 2020. It's to help address the opioid epidemic and develop solutions at the community level. This is no surprise to anyone, but New Jersey is in the midst of an opioid abuse epidemic. There's not a day that goes by without hearing or seeing a story in our neighborhoods or in the media on the impact of the misuse of prescription medication, heroin abuse, the countless overdoses impacting all of our communities, and so many of our families dealing with the day-to-day challenges of this crisis and the disease of addiction. Cape May is not immune. No family or community is immune. And today, we gather to learn how the community can address this epidemic, how individuals can make a difference in fighting this crisis, how we can prevent more of New Jersey's residents from becoming addicted, how we can reduce the stigma of addiction, how we can help those who are addicted, how we can support those in recovery, and how we can bring awareness to this crisis. The Partnership for a Drug-Free New Jersey and the Horizon Foundation for New Jersey are pleased to bring this discussion at Cape May today, along with our collaborative partners, the City of Cape May, Cape Assist, the Cape May County Chamber, and Cape Regional Health System. We thank you all for joining in this important conversation. There's no easy answers for solving the opioid epidemic, but there are ways each of us can make a difference in this important fight. It's necessary for everyone, parents, community leaders, students, and residents, to work together as a community and to develop ways to end this opioid epidemic, to change the public attitude towards addiction. This town hall and other efforts to educate and improve and empower New Jersey residents are important steps forward to making that change, which will ultimately reduce and prevent opioid abuse in Cape May and Cape May County and throughout the state. So thank you so much for joining this conversation today. It's now my pleasure to introduce our sponsor for today's town hall, from Horizon Blue Cross Blue Shield of New Jersey, our friend John Pearson, Director, Corporate Social Responsibility and Executive Director of the Horizon Foundation for New Jersey. John?
Thank you, Paul. Good morning, everyone. How's everyone doing today? Great. It's really great to see so many folks here, especially students, parents, other leaders. Before I start, I just want to special thank you and call out to the partnership team here, and really Angelo Valente, Matthew, who's leading this effort for us statewide, and the person who keeps the glue together all the time, Angela. So thank you for all your help, and the many folks that are part of the team that you may not see here today, but there's a lot of effort for putting on these town halls, so I just want to thank them for their dedication. Yep, please. It's really my honor and privilege to be here today to represent Horizon Blue Cross Blue Shield of New Jersey. You know, we're headquartered up in Newark. I've been with the company now, it'll be 25 years. I'm from Newark. I was born in Newark, and my family's from there. But, you know, it's important that we move around the state to address this issue, and that's why I'm really here today, because our company covers the entire state of New Jersey and all of our members and all of the communities that we serve. But I also want to give a thank you to Paul. He's a good friend, and for his time today moderating our town hall. So as Paul mentioned, through Horizon, we have a philanthropic arm called the Horizon Foundation for New Jersey. We're extremely proud of our relationship with the Partnership for a Drug-Free New Jersey. The company's had a long-standing relationship, but in 2017, we developed this Knockout series, which we're bringing to you here today. We're also addressing this from a company perspective, again, through our members and our provider partners, our physician partners, you know, how this issue is impacting not only the communities that we serve, but our 3.6 million members. Our foundation began in 2004, and we made many grants since that time, about 1,500 grants to nonprofit agencies in New Jersey. But I will say that this grant, it's really beyond the dollars that we provide to the partnership. This grant and this program is one of the most important and vital initiatives that our foundation has undertaken in my tenure. I've been the executive director since 2012 and a privilege to lead our foundation. We've invested about $1.5 million in opioid prevention and education initiatives since 2017. And as you all know, and why you're here today, this epidemic is impacting many people. Last year in 2018, we lost 3,100 New Jerseyans to this issue. That number continues to grow year over year. We all know this is a public health crisis and epidemic, but you're here today and we're here today to come out of today's meeting with solutions to address this issue. And I know many of you and Mayor Lear, under his leadership and his credit, we were here last year in Cape May County, and the mayor said, hey, we want you back and we want you in this community. So thank you, Mayor, and we're glad to be back here. I also want to thank the freeholders, the deputy mayor, and all of the key folks that are here, including many of our partners. In closing, I just would like to say that this couldn't happen again without all of the agencies that brought us together, from the Cape May Convention Center, the city of Cape May in particular, Cape Regional Health System, Cape May County Chamber of Commerce, all very vital to bring this together. Many folks I can't call out today publicly, but we thank you for your help. And also, I want to thank the distinguished panel. You're going to have terrific folks on this panel today, experts in this field, experts in the community. We really appreciate their support. But again, my final point is, together we can have an impact on this issue. We can come out of this with solutions, and we're not going to continue to let this be pervasive in our community. We're really trying to address this. So I thank you all for your support. I look forward to the town hall. Thank you so much.
Thanks, John. You know, for all the students here, I'm just going to segue a second. As president of the New Jersey Broadcasters Association, I just came back from a radio show in Dallas, and we learned that millennials, Gen X, and Gen Z love Netflix and love radio, and I love that. So thank you very much for it. Now, I also want you to know that stick around, because there's a chance for you to win an iWatch later today. We'll tell you about that later, but stick around for that, and that'll be coming towards the end, and we'll tell you how you can enter that drawing, okay? Again, Jonathan, thank you for your leadership and the commitment that Horizon Blue Cross Blue Shield of New Jersey and the Horizon Foundation of New Jersey are making for this issue. Again, I'd also like to thank the City of Cape May, which has been so welcoming, for all of its hard work in putting together this important event and for hosting this town hall at this beautiful venue. To say a few words on behalf of the city, I'd like to welcome Cape May Mayor Clarence Lear III. Mayor.
Good morning, everyone. I'm so gratified to see so many people here this morning for this most important town hall meeting. Please join me in expressing our appreciation to the Partnership for Drug-Free New Jersey and Horizon Blue Cross Blue Shield of New Jersey and its Horizon Foundation for organizing these town halls and for guiding us in knocking out opioid abuse. Thank you. We're here to learn more about the opioid epidemic in our country and our state and how we might deal with it in our local community. It is a drug menace that has touched so many of us, directly or indirectly. I am sadly stunned when I think of how many people I know who have suffered in some ways because of opioids. When even one story of opioid abuse is one too many, there are countless stories about how quickly pain relief becomes pain management, becomes opioid treatment. Then how dramatically opioid treatment becomes addiction, then often and sadly, death. Research has shown the stark consequences of abusing opioid medications. Even a person with a one-day prescription is at risk of addiction. A one-week prescription can double that person's addiction risk. The importance of being here this morning cannot be overstated. We're here to understand the well-intended origins and widespread misuse of opioid medications. Misuses by pharmaceutical manufacturers, by prescribing physicians and other healthcare providers, by caretakers and enablers, and by individual users. And to learn how we can join the fight to prevent those misuses in ways that support recovery and save lives. I hope what you hear and learn here today will be so shocking you will agree this is a fight worth having. We cannot turn away from the reality and the magnitude of this crisis, nor can we stand back and marvel at its devastating consequences. This is no time to be uninformed or naive or embarrassed about what is going on in our families, our schools, and our community. We must join forces, pharmaceuticals, healthcare providers, insurance companies, governments, businesses, education, social services, civic organizations, and churches, everyone. We must be committed to winning this battle because together we can knock out opioid abuse. Thank you.
Thank you, Mayor Lear. Today's town hall is about learning, just not from our expert panelists, but from you, the members of this community, especially our students. We want you to share how this epidemic is affecting you, what's working in your community to address it, and what is not. And the questions you have or the recommendations you want to share, we'll look forward to hearing later. It is vital that we hear your feedback on this issue. In fact, each of you was given a survey that you can complete at the conclusion of today's town hall. This information you'll provide helps us to understand how the opioid epidemic affects your community and how the Partnership for a Drug-Free New Jersey and Horizon can most positively impact communities at future Knockout Opioid event town halls. Everyone that completes the survey and hands it into our staff at the end of the event will be entered into a drawing to win an Apple iWatch. That's courtesy of Horizon. So now we'll hear some brief introductory comments from our panelists, and let me introduce them, and would they please join me on stage. It's my pleasure to introduce first Chief Alex Coulter, the Cape May Fire Department. Thank you, Chief. Vicki Clark, who is the President and CEO of Cape May County Chamber of Commerce. Vicki. The Director of Prevention of Cape Assist, Joe Faldetta. Joe, would you please join us? A special friend, a person in recovery, Brian Leach. The Executive Director of Cape Regional Foundation, Tom Paretsky. Thank you, everyone, for being a part of this panel. This is like the Tonight Show. You know, you sit down, you move down one. Well, thank you all. We're going to start, Chief, with you, Chief Coulter. Could you discuss, from your perspective of emergency medical personnel, what impact the opioid epidemic has had on Cape May?
Definitely. Being in the fire and EMS world, Cape May is not immune to opioid abuse or any drug abuse. Unfortunately, it's a very transient population in the summertime. We swallow about 50,000 visitors on top of our 4,000 residents every year. And on the professional side of it, we have had to combat this by protecting ourselves on top of having to protect the citizens. So we have gone as far as to purchase special EMS gloves that are resistant to fentanyl. When we go into situations where we believe that an opioid has been abused or is present, whether it's in pill form, powder form, or however they can use it, we have masks that we wear that are special masks so we don't become exposed also. For those of you that have watched the news and seen what goes on, emergency responders are at risk every time we respond to an emergency as it is, but with the current opioid abuse and the exposures that we are having now, we've had to take extra steps to protect ourselves. And the one thing that is very disconcerting for us in the EMS end of this job is we all carry Narcan in our ambulance along with many other drugs that the state of New Jersey now allows us to administer that are non-evasive. And the amount of the Narcan that we have actually gone through since the program began is very disturbing to us. And it's something that unfortunately we have to deal with. The police deal with it, we deal with it. Unfortunately, it's something that we're not going to get away from anytime soon. We can just give more education. But for the providers, it's a hazard, and it's a big risk for us. It doesn't have to be inhaled. It doesn't have to be ingested. It can be absorbed through our skin, so we have to take all the necessary precautions for that.
Great, thank you, Chief. Vicki, the business community and tourism industry are probably the most important industries in Cape May and the surrounding communities. And how can the business community help play a role in addressing this crisis?
Well, our business community is primarily made up of small businesses, lots of them family-owned businesses. And as you said, we work in the tourism industry, which can be very grueling, long hours, and many times that can contribute to the substance abuse crisis. The business community in Cape May County, I think, can be a huge resource to getting information to employees and providing information and communication both ways. And I think that our organizations that have resources to help people in addiction can use the business community maybe more effectively, and businesses need to be more open to being that resource. And that's one of the things that we're trying to initiate through the Chamber, is to be that communication link. And there is, some privacy concerns, I think, with people, and it's something that is it's very personal, and people don't really know how to open up and be that communication resource without violating privacy issues. And we're trying to work through some of those concerns so that businesses know how to provide the right kind of information to their employees. Employees know that they can get information in a trusted way. But businesses want to have healthy employees in their businesses, and it's to their benefit to provide this information to their employees. And many times the employees are spending more time in the business than they are any other place, especially in the tourism industry, because they work such long and grueling hours during the height of our season.
And I would think that it's not just a matter of the workplace performance of the employees, but their family members. If they have a family member who's suffering from this disease, it's going to affect their performance and maybe their absenteeism and some other things too, right?
Exactly, and it may not be the employee, but it may be a family member or a loved one in that employee's family that they're dealing with at the same time they're trying to balance with their job.
Great, thanks, Vicki. Joe, prevention will play a key role in addressing the opioid crisis. What prevention methods have proven to be the most effective, and what kinds of prevention resources are available in Cape May and the surrounding area?
Thank you, and thank you for having me. I guess I should start before I talk about effective prevention methods, just to sort of say that there is no silver bullet to this. It's not just one strategy that's going to solve this problem. It's like Lynn Kurkowski told me 13 years ago when I started working in this field. It's multiple strategies across multiple sectors, and it really is a community working together that's going to address this problem. I will say on the prevention side, I think what's been very successful for us is when we started to focus on resiliency. And the way that we started to foster resiliency, mostly in our youth, was by focusing on things like Botvin's Life Skills. This was a program that we would bring into middle schools, into high schools, to teach youth to have a strong sense of self-esteem, goals for the future, effective ways to deal with stress, effective ways to deal with anxiety. All of these things that make the individual more resilient doesn't just make them more resilient or less likely to develop a substance use disorder in regards to opiates or alcohol. It makes them more resilient across the gamut of substances. And as we work to build resiliency in our youth and to build resiliency in our community, that also helps us because what we're starting to see with the opioid epidemic and what we're seeing more of is cycles of trauma, or what we're referring to as adverse childhood experiences. And what we have is a lot of youth that are being exposed to repeated trauma day in and day out, as perhaps maybe they're living in a household where there is somebody addicted, or they're living in a household where there is abuse or where there is neglect. And that repeated exposure to trauma makes it much more likely that they will develop a substance use disorder. So by promoting resiliency, by promoting those healthy coping skills, by providing them with good decision-making skills, goals for the future, and surrounding them with trusting relationships, we can work to effectively combat ACEs, and we can work to make that youth more resilient. And I think if you take it even a step farther, the focus on resiliency, I mean, we have a lot of students here today from our hospitality and our culinary programs. We're taking the time to teach these students necessary skills that they're going to have to be successful in their occupation. Here in Cape May County, we have a big hospitality industry and we have a big construction industry. And the hospitality industry is going to offer these students an opportunity to be very successful financially, but we also have to understand that the hospitality industry, it's a high-risk occupation. And if we're not properly, we need to properly prepare the students to be resilient in that occupation. So not only are they able to perform the functions of their jobs and be successful that way, but they're able to grow in their professions and be happy and be healthy and be able to cope with the stresses of their job without the utilization of drugs and alcohol. So really infusing resiliency into everything that we do in prevention has been one of the more effective avenues of what we're doing in prevention. I mean, to highlight resources, there are truly multiple strategies across multiple sectors here in Cape May County. With the help of the freeholders, we were able to get medication drop boxes in every single police department in Cape May County. So wherever you live in Cape May County, you can dispose of old medications to get them off of the street. For our older adults, we utilize programs like WISE, because even which is a program about healthy aging. So as seniors are going to be prescribed more medications, we're providing them with the education that necessary to know how things interact and what to do with medications when they no longer need them. We use programs like Strengthening Families, which have been funded by organizations like Ocean Incorporated, where we basically try to engage the entire family to promote that message of resiliency throughout the family, so there's a good family dynamic between parent and child. I mean, the partnerships that we've had with law enforcement, you see the Hope One van here today, which was a partnership with the prosecutor's office. It's just an amazing resource to be able to go out and try to meet people where they are and connect them with services that can help them deal with addiction. So, I mean, there are so many partnerships that we have in so many prevention efforts that are really doing amazing things. I mean, the last one I'll just highlight is the program they recently have in Middle Township, the Handle with Care program. And that was something that Chief Lusner was instrumental in. And now that if the police were to go out to a child's house on some type of call, they inform the school to please handle that child with care. They don't say what happened. They just let the school know that the police were out at the person's house the night before. So maybe they might want to check in with the student, see how they're doing, make sure that they're okay. That type of communication, those types of proactive strategies are ways that we're addressing trauma and trying to foster resiliency in our community.
Joe, you mentioned the Dropbox program. I don't know if everyone knows, but that was something that was started by Angelo and the partnership about 11 years ago, Operation Medicine Cabinet. And that's when we're allowing people to get rid of their old, unused, expired prescription drugs without any kind of questions asked, just drop them off. And we started doing that in New Jersey. And that's something we help promote through our broadcasters. And it got the attention of the White House. And it became a national program the DEA runs called Operation Take Back. And it's in every state now in the country because of what we did here and what Angelo and the partnership have done in New Jersey. So I'm very proud of that. And I remember when the first drop boxes were put in here, so that's a good thing. I want to follow up real quick. That sign over there, signs and symptoms of opioid abuse. How are we teaching our young children to be aware of this, especially as they enter the workforce and are exposed to the outside world? How are they being trained to recognize these things and to be aware of them?
I think what we're really focusing with youth is the idea of the healthy coping skills, right? We all have stress. We all have anxiety. As they enter into the workforce, there's going to be specific occupational risks that come along with wherever they are working. And we just know that construction and hospitality tend to be higher risk environments because of the demands of that profession. So if we can help foster those healthy coping skills, if we can foster anxiety management, stress management, help the kids learn their ways to relax, so when they're done working, they're able to decompress, they're able to relax without the use of drugs and alcohol, then we're properly preparing them for their future.
Okay. You mentioned the Hope One van. I know we have Lieutenant Landis and Cheryl Spaulding with us from there, so I appreciate you guys being here and being part of this today. Brian, you have the most intimate experience, I think, with this whole situation, this whole issue of anyone on the stage, and it's really important that we hear from you, and I'd like to know if you could tell us a little bit about your struggle with addiction and your path to recovery.
Okay. Good morning, everybody. It's a great honor and privilege to be sitting up here today, and I want to thank you all for being here. And I'm a recovering drug addict and alcoholic. My name's Brian Leach, and I'm also a local business owner. And my struggle started at a very young age. I grew up in the inner city of Philadelphia, and I had my first drink, and I was 7 years old. My brother was actually the one that gave it to me. He's a couple years older than me. And the very next day, I went to school. I came home. I went right back to that empty lot at the end of our street. And I was drinking and smoking pot the very next day. You know, progression for me was very quickly. My story is a lot different than some others that you may hear. By the age 8 years old, I was putting needles in my arm. I no longer played with toys and watched cartoons. I played with bottles and drugs. And there's a lot of, before that even happened, there was a lot of stuff going on in my household, a lot of stress. My father was an alcoholic who's actually in recovery now. He's got about 20-some years. So there was a lot of stuff that went on. So what happened was, I started putting needles in my arm at a very young age, and addiction for me went off, and it went very quickly. The only time I really ever went to school was to get drugs, sell drugs. I fought in the streets a lot, and that got me in a lot of trouble. I fought in schools a lot, and that got me in a lot of trouble. I was an angry kid. So what they did was they punished me a lot. I got in a lot of trouble to the principal's office a lot, things like that, and people always yelling at me, and I just didn't know what to do, you know. So I just continued to do what I was doing, and I was an angry kid. My mom and dad got divorced when I was 7, so it was just my mom. She worked 2 jobs and then went to the bar afterwards. So I pretty much, me, my brother and sister. I'm 47. My sister's a year older. My brother's 2 years older, and we pretty much ran and did what we wanted to do. So I would continue to go on, you know, using drugs and alcohol in schools and stuff like that, and I got in a lot of trouble in school. The age of 11 was the first time that I was arrested. I was arrested at 11 for selling drugs on a street corner in North Philadelphia. That started my journey through the juvenile system. Real quick, I don't want to spend too much time on all that. My birthday's in January, New Year's Day, and I've never seen a Christmas or my birthday from the age 11 to 21. Every single time that around that time of year, I was always in, you know, juvenile detention center or in prison. When I turned 18, things stepped up. My mom she actually put me out of the house. I was 12 years old. I moved from place to place. I lived with my dad for about 1.5 years, and then it was kind of like never unpack my bags because I didn't know if I was staying. You know, foster care, all different kinds of different situations along them lines, and you know, they would just get rid of me. I was angry. I would do mean things, bad things, and stuff like that. And people didn't really realize what I really needed was a hug. You know what I mean? I wasn't a bad kid. I was just hurting. So, you know, when I turned 18, I graduated to jails and penitentiaries, and that's pretty much what happened to me. I got arrested. I guess I was 18 years old, and it was straight to jail for me. And you know, I would do things for drugs. You know, I would rob people, steal cars, sell drugs. I robbed drug dealers in Philadelphia, things like that. So the crimes and all that stuff graduated too, you know, as my progression went on. So, you know, I wound up going to jail. I was 18 years old. I was up in Gradersford Penitentiary and in Pennsylvania. And they tried to kill me up there. They stuck a shank in my back, somebody that I robbed previously. And I wound up getting out of there, and I went back to the streets of Philadelphia. And at that point in time, you know, I was homeless. You know, I was living on the streets, and that went on for years. You know, they would get me, they would lock me up, I'd get back out, and I would continue to live like that. You know, for a couple years that went on. When I was 23, I moved down to South Jersey here, Cape May County. My dad was down here. He was getting his both his hips replaced. My dad and my brother are ring fighters. My brother took silver in '88 Olympics, and so we would fight. So that's why he had to have his hips replaced. So I came down here and I continued to do the same thing that I was doing in Pennsylvania. Trouble followed me very quickly down here. Wound up in jail down here, and you know, I'd go, I'd do my thing, I'd get back out, you know, and then I guess the first time that I went to like an AA/NA meeting, you know, 12-step recovery, I was 12 years old. So I spent a lot of time in and out. I've been to a lot of rehabs, a lot of detoxes, a lot of counselors. I guess, you know, the last count of detoxes and rehabs in you know, places like that was about 40. So I came down here and I continued just to get in, you know, a lot of trouble. You know, I've been through a lot of programs in the penitentiary system, and you know, I nothing really ever took hold. You know, the desire, the want, really was never there. Until I came down to New Jersey, then I started to try and really spent a lot of time trying to get sober, and I had a very tough time, you know, beating this thing. So I wound up, I guess it was in 2005, I had a job I had to go do for, I work in construction. I own a construction company down here now. And I was working for an outfit that sent me out to Reading, Pennsylvania to do a job out there. And within 12 hours of leaving Cape May County, headed to Reading, Pennsylvania, I was sitting in a state police barracks in Reading, Pennsylvania with a $100,000 cash bail looking at 25 to life for a career criminal. For the same thing I always did, burglary, you know, and stealing and robbing. And, you know, for the first time, I was scared. I was scared to death. I got out on bail. You know, and I went and I got sober again. You know, I started going to some meetings. I started reaching out to some people, and I wound up going through trials and all that stuff. And it doesn't really matter what happened. I wound up having to go back to prison for a little while in Pennsylvania, and I went back to prison actually sober. And when I was up there, I got in touch with some people, and they actually gave me a job out there, running meetings and things like that. And I spent a lot of time working with a lot of guys. And I noticed to see some things that really touched me and hit home with me was watching guys come in and working with them and watching the lights come back on, you know, and seeing guys get out and getting their lives back together and stuff like that. You know, and so I wound up coming home. I came back to Cape May County, and I had a little bit of time. I had a little bit of time clean, and I had a very tough time. And this has to probably do with the next question you have to ask me. Getting a job, you know, very skilled at what I was doing, construction, but because of my reputation, because of my my record, I couldn't. Nobody wanted anything to do with me. So I wound up starting my own business, and I was doing very well, and but there was still no coping skills. I had no idea what I was doing. I didn't have much of an education. You know, I reached out to a lot of different people, you know, in the community and in recovery and stuff like that, and them guys actually helped me. They helped me to push ahead. They helped me to get my license in contracting and stuff like that, and so I kind of focused on making money, and I made a lot of money. And what happened was I wound up picking up a drug again, an opiate, and things got real bad real quick for me. And there I was again, you know, in trouble with a lot of new charges in Cape May County within 10 months. Happened real quick for me.
How'd you get exposed to the opioids? How'd that happen?
When I first picked up, when I was 8 years old. When I started I wound up shooting methamphetamines, and then what would happen was I would be so speedy I would need something to come down, and that's where the opiates came in.
So that was what I guess somewhere you triggered. You're on your recovery. You're making money.
Yes.
And someone offered them to you, or you found them.
Well,
How'd that happen?
there's a little bit more to the story. I was in a street bike accident. I used to, ride motorcycles. I used to fix motorcycles and all that stuff. And I was actually, it's pretty crazy. I was hit by a drunk driver in Philadelphia. And I was in a wheelchair for a while. So I live in a lot of pain. And I still live in a lot of pain. I wake up in the morning. I'm usually up in the morning. I get up around 2 o'clock every morning. I wind up doing my paperwork. I actually own 3 businesses in Cape May County. So I get up, I do my estimates, I do all my paperwork because I cannot sleep because of the pain. I don't take any more opiates. I really don't take any kind of medication except for an ibuprofen here and there. When I had my accident, I was actually sober at that point in time. I was with someone. My daughter was born. That was right before I moved to Cape May County, and I wound up back on opiates through the accident. So that kind of set me off again. So I kind of learned from that experience, I don't play with this thing because my body doesn't know whether it's coming from the street or it's coming from a doctor.
Right. Did the stigma of addiction have a negative impact on recovery and your treatment options?
I guess, because of my my extensive long use has had an impact, because there's a lot of you know, and I go way back, and things were a lot different. You know, 30 years ago, 30-some years ago, things were a lot different. It's a lot easier today. There's a lot more understanding today of this disease. People are a lot more willing to help. But there was a period of time when I couldn't get any kind of funding. They didn't want to take a chance on me because they figured I was just going to do the same thing again. And when I wound up in trouble again, after having that time sober, I was looking at a lot of time in the state of New Jersey. And what happened is at that point in time that the drug court program became available. And that's what happened to me. I wound up on the drug court program in Cape May County. And they sent me away to rehab, and they gave me a shot. You know, they gave me a shot. And at that point in time, you know, there was a lot of people, you know, through my life that it was like I had the plague. You know, places didn't want to hire me. People didn't really want to do wanted anything to do with me. Friends, family, things like that. So Cape May County and the court system took a chance on me, and the probation officers, and they helped me. I mean, they showed me, you know, how to live once again. You know, they sent me in that direction, and they hooked me up with the places and people I needed to, you know, to get me where I'm at today.
I would say, Brian, thank you for that sharing, and it takes a lot of courage. It ain't easy.
No.
And thank you for sharing that with us today. It's very compelling. I'm glad to see you're on the right track.
Thank you.
You know, it's funny. I had an operation about a year or so ago, and it's really weird. I had an operation, and I was never in the hospital in my life before, and now I'm in for 11 days, and they cut me apart, and they kept on pushing the Percocets on me. I mean, the nurses, I would say, look, you know, because Angela taught me, make sure you don't take these things too long. And after 3 days, I said, I want to stop. And they kept saying, no, the doctor prescribed these. You have to take these. I'm like, no, I don't. They were prescribed for you. You have to take these. I couldn't believe it. I'm witnessing. I'm thinking of all the stuff you guys taught me. And I'm like, wow. And I had to really fight them. And and it sounds dumb because it would have been easy. They were putting Dilaudid in me and then the Percocets just kept coming every so many hours. And I had to convince them to put me on Tylenol. And it was, and if I didn't know any better, because of what I learned at the partnership, I could have probably been hooked on these things because they were forcing them down my throat. And I thought that was just ridiculous. But thank God I knew a little bit about it. So again, Brian, thank you very much. It could happen to anybody here, and obviously you're, like I said, on the right track. Tom, a little change up. Adverse childhood experiences, or ACEs, can have a major impact on a child's future. What effect could a parent's substance use disorder have on their child, and how does the Cape Regional ACEs program work to address these issues?
Thank you. Before we get started, I want to just give a little background about our ACEs project. 4 years ago, we were awarded a grant from the Robert Wood Johnson New Jersey Health Initiatives to look at creating a culture of health in Cape May County. And we put together a core team, which included Chris Lusner from law enforcement, Vicki Clark from the Chamber, Greg Speed from what was then Cape Counseling, now Ascenda, and Chris Kobik from our education sector, and myself from the healthcare sector. And we spent the first 9 months looking at our community and finding out where the need was. We thought it was going to be substance abuse and mental health, but everything kept going back to adverse childhood experiences. And to be honest with you, nobody in that group even knew what it was until we started hearing more and more about it. Unfortunately, Cape May County has one of the highest rates of adverse childhood experiences in the state of New Jersey. So we felt this is where we wanted to start our program, and it's been a real eye-opener. One of the first things that we did was we went to the freeholders. We thought it was going to be a 5-minute discussion to get a resolution from them. Turned out to be almost a 45-minute conversation with them leading on and saying, how can we help you? We realize this is an important part of our community and providing a healthier community. The ACEs is a survey that is taken. It's 10 questions. It has to do a lot with what Joe talked about before. It's resiliency and trauma that our children have in their growing up in their lives. Unfortunately, it's also generational. It can go from one generation to another generation unless we do something to break that cycle of ACEs. Substance abuse is a major part of our ACEs survey. We know that when we take this test, this survey to our kids, if they score more than 2, they probably have some effects from ACEs, and their chances of becoming addicted themselves is 2 to 4-fold. And that keeps increasing the more we have people. And we do have kids that have 5 and 6 ACEs on their score, which means they have a terrible chance of becoming addicted to drugs, alcohol. In our community, we also have one of the highest rates of physical abuse and neglect, another prime factor that we see in our ACEs score for creating some of the problems we have. Many of the times, our ACEs patients, our kids, will go to drugs and alcohol as a solution for trying to cope with what they're dealing with. And as Joe talked about before, we're trying to do a lot now to break that trend and work with resiliency. Through our grant, we were able to bring a Dr. DeSotis from Butler University out in Indianapolis, who for the last 2 summers has provided 3-day trainings to all of our educators. We started with Lower Township, Middle Township, and I think we've expanded to the entire community now, the entire county. I'm doing ACEs training, resiliency training, and trauma training, so that at least our educators know. From that program, we have our Handle with Care that Joe mentioned from Chief Lusner brought that program, but it hasn't just stayed right here. Chief is making it a goal of his to get that out to the entire state of New Jersey. We have a summer youth camp that the Middle Township Police started several years ago, which through this grant has expanded now into Lower Township, the Wildwood, Sea Isle City, and hopefully Woodbine in the future. But one of our main goals was to get awareness of what ACEs was, because so many people had no idea what we were talking about, and then to start putting together programs. Another program that we have through our grant is a Big Brothers Sisters mentoring program with sophomores in high school and 7th graders. We know that one of the transitions from high school, junior high to high school can be very traumatic. And hopefully with this program, I think we had 32 participants last year in our pilot program, participated, and we're seeing some great improvements. We have a long way to go, but we're making some great strides, and we know that these kids watching their parents with their alcohol abuse, with their opiates abuse, has a direct correlation on them also becoming addicts if that's the direction they take. And it's also creating a very traumatic experience for them. The one thing that caused us to actually go into this ACEs project is one of the groups that came into us shared with us that there's probably a 20% greater chance of having chronic disease if you're affiliated with ACEs, but also you have a 10 to 15 year life expectancy less than someone who doesn't have ACEs. And hearing those numbers was pretty traumatic, and that's when our group decided that we were going to take this ACEs project on as part of what we wanted to do.
Great. Thanks, Tom. Well, thank you to all our panelists for sharing their knowledge with us today. And now I'd like to ask the panel some questions that were submitted by attendees prior to this town hall today. And some of you addressed and touched on some of these if you want to amplify them, or whatever. But the first one has to do with Cape May's economy, which is based in large part on tourism and the hospitality industry. And in what ways has that affected what the opioid epidemic's impact has been on the area? I guess, Vicki, you might.
Well, the opioid epidemic certainly creates workforce issues for businesses. We have very significant workforce issues in Cape May County. We have higher than normal the unemployment during the off season, as we would call it, which creates a very negative impact on the community, and we find that contributes to some of these substance abuse issues that we see in Cape May County. Those issues hinder our local community from being prepared to go back to their jobs when the season rebounds and jobs are more plentiful during the summer season. And as we talked about before, the long hours of the summer season then, are a contributing factor, as Joe was talking about, in tourism and in the construction industries that tend to create, reasons that people turn to drugs and alcohol to get them through those shifts and things like that. So those all contribute to the workforce issues. So we have not enough jobs year-round, and we have not enough people in the height of the season to fill the jobs that we have. So it's, it's very cyclical. It goes on and on and on, and it just feeds on itself. So we have to break the cycle. As Tom was saying, adverse childhood experience is a syndrome that is cyclical. It's generation to generation, which is why we have chosen this issue to try to break the cycle and to get children out of the repetition of it.
I think it's probably harder in resort areas because of what you said. It's feast or famine.
Correct.
You're either working very hard or not working at all. And then when you're down here in the summer, everybody's coming down here to party, so the influencers are everywhere.
Right.
And the pressure must be pretty great. I don't know if that's something you've seen. Is that typical, do you think, in resort areas? Is extra problems compounding the problem?
It is. We see it as we see, people who are living in motels. That's something that we see in lots of tourism areas. We see that is a cycle. It's not just unique to Cape May County. It's something that we see in many tourism areas throughout the United States. And it's not a healthy lifestyle for people. But it is something that the government has fallen back on.
That's something maybe Division of Tourism. There should be programs maybe not just to increase tourism, but to help the industry itself and recognize that these might be unique problems or exacerbated problems with our resort communities in New Jersey. That's really interesting. That's good stuff. By the way, are there mechanisms that you put in place now to help business owners to recognize and to help seek treatment and give them the pathways to treatment?
There are programs that are being developed, and as we said before, they're a way of getting information to businesses they can provide to their employees, training businesses to see what signs and symptoms are for their businesses. There are huge insurance risks to businesses if they have employees that are coming to work that are under the influence. It's not a healthy situation for the business or for the employee. Businesses want to have productive, healthy employees in their business that cost them a lot of money to train their employees. So it is in their best interest to help the employees that they have. As Brian was saying, he has a lot of skills. He's a very talented person in the construction industry, but he had a hard time finding a job, someone who wanted to hire him because he was a very high risk. He had to prove himself that he was worthy of that job. Businesses, sometimes they get to the point where they cannot take that risk. So, it's a very hard situation to be in for the business. And, they want to have that skilled employee. They've invested in them. They've trained them. They've brought them back year after year after year. So we want to help the businesses have that information to get the employee to get the help that they need.
Thank you, Vicki. What's being done to address the lack of access to treatment, especially medically assisted treatment, and the reason for the lack of access, including stigma, transportation issues, as well as lack of insurance? I don't know who that would like to throw it out to. Who wants to take a jump at that one? Sure. Like, what are the different issues, I guess, that you're finding regarding the lack of access to treatment, especially medically assisted treatment, and the reasons for this lack of access, if there is a lack of access, including stigma, transportation issues, getting people back and forth, as well as maybe lack of money and insurance coverage?
Sure, so I can try to take a crack at that. If you have insurance, you can get treatment. So there are a lot of really nice facilities that take both in-network and out-of-network benefits. They rarely have a wait. What tends to be difficult to get people into treatment is those who don't have insurance or who maybe have Medicaid. For those who are on those who don't have insurance or who have Medicaid, there are other ways for them to get treatment. It's just there is usually a wait for those beds, and that's really what our biggest problem is. So the state has put into place something called the IME. It's a 1-800 number that you call up, and whether you have insurance or you don't have insurance or you have Medicaid, whatever kind of insurance you have, they take your insurance, they put it through all of the inpatient treatment facilities in the state, and they will let you know who has a bed for you. What tends to happen more times than not is that if you have Medicaid or no insurance, you may have a wait of maybe a week or two to get a bed. So for those of us who kind of understand substance use disorders, if you have somebody who has the motivation to get treatment, right, you want to capitalize that on that immediately. The last thing you want to do is say, can't help you now, but come back in 2 weeks and we'll help you. So what we want to be able to do is start the connection. So even if there is some type of wait, here in Cape May County, there are outpatient treatment facilities that could start somebody on a high level of care, probably somewhere around 10 hours of counseling per week. Is that maybe not as much as they need? Do they probably need something inpatient? Yes, they probably do. But at least what you're doing is you are connecting them to some service, and you're keeping them connected while you're waiting for that bed to open up from them. And what you'll kind of see is, at least by taking that type of step, one of two things is going to happen. One, they may be very successful in outpatient treatment. And if they are successful in outpatient treatment, then there's not always a need for them to go inpatient. Or after a week or two of being in that inpatient treatment, or in outpatient treatment, their inpatient bed can open up, and then you can send them to a facility that can offer them more encompassing care. But the most important thing is that you get them connected as quickly as possible. Hope One does a really, really great job of that, of getting people connected to treatment. They have a good understanding of what resources are available, especially for those who are uninsured. Because even facilities that only take private insurance, or facilities that only take in-network benefits, those facilities a lot of times will offer scholarship spots to people who don't have insurance. And Hope One's a really good resource to get people connected, because they can help them work through the IME and find them a bed as quickly as possible. But if there is a wait, getting them connected with some type of care while they're waiting can be very helpful.
Quick follow-up. Do you agree that short-term treatment, e.g. 5 days, detox, 20 days treatment, is ineffective in achieving a long-term sobriety result?
Sure. Detox is just that. It's basically getting a person to a point where physically they're able to take part in the therapeutic process, right? And ultimately, treatment has to be achieved in their community, right? So if I'm going to send somebody away to detox, and then I'm going to send somebody away to 20 days for treatment, now I'm going to send them back to their environment where that was the environment where they were using. They have the same friends. They have the same job. They live in the same place. Nothing's changed, right? I'm going to keep living the same life I used to live, only now I'm just not going to use. Well, that's not realistic, which is why treatment in their community while they're recovering is so important. Because what you're going to do is you're going to surround them with support through formalized counseling. And as they develop their own support networks, as they utilize things like AA or NA or their church communities to build recovery capital, as we would call it, then we start to take those formalized treatment things away. But they need support and they need help over the long term as they're making new friends, as maybe they have to move to a new occupation or learn a new skill or find a new place to live or reconnect with a family that maybe they've alienated through the process of addiction.
Thank you.
Just to add
Tom?
to what Joe said, we also, when a person comes in with an overdose at the hospital, we're also matching them up with a recovery specialist, hopefully within 30 minutes. We have found that the best time to go to someone who's overdosing to get treatment is while they're coming out of that overdose. It's called the CARES program at Cape Regional, Cape Addiction Recovery Services. All our recovery specialists are former addicts, so they have a great relationship of dealing with that person and what they're going through at the time. And we've been very successful in getting them into facilities for treatment directly from our ER into a treatment facility.
And follow-up care and stuff, you're being
Follow-up care is actually a year because we feel that that's how much time they need in order to make successful transition.
Thanks, Tom. Chief, like a good fire chief, you've been here and waiting patiently, but when we need you, baby, we need you right away. My uncle was a fire chief in Patterson, actually, for many, many years. So I kind of always enjoyed riding the fire truck and ringing the bell and stuff. But This question I'd like you to expand a little bit about, and also as you see it in the community. The number of naloxone administrations statewide has grown significantly in recent years. What can we do to help people who are administering naloxone access treatment, and get the help they need to understand and make sure people are aware of what it is, how it works, and where they can get it and how they can use it?
Well, you could come to any emergency medical facility, whether it's an urgent care, fire department, police department, and we are all trained through our medical director, who's a doctor that oversees our operation for EMS, and we would be more than happy to go through the process and train you on how to use it. It is a medication, it is a dosage medication. There are some adverse outcomes sometimes, depending on the situation. There's some violent outbreaks that can happen when the Narcan is administered, when the person who's in the overdose comes out of it. There's some health effects that are not so pleasant that come with it. But anybody who needs any information or we're training on it, we actually have training aides in the fire station in Cape May that you can come in, and we would be more than happy to sit you down. We have information. We can show you how to use it. Go through the ins and outs of why it works. It's not, I mean, it is a miracle in the sense of how fast it works. But the one thing that I would really like to instill on especially the youth in the room is it's not a fail-safe. If the guy standing next to you happens to have Narcan, that's not an open invitation to see if it works, because it may not. So, but any training or any information, I know the urgent cares now have it. You can go in there and get it, and any information anybody ever need, feel free to, you can stop by the Cape May Fire Department anytime. We have, like I said, the training aids and the information. We can help with that.
Yeah, I didn't even realize, but I'm thinking about it. I didn't even know. That's right. Someone coming out of that because they administered the drug, they may not be so happy that you did that.
Most of the time, they're not.
Interesting. No one ever trains us on that. They just train us on get the shot in. What have you noticed any kind of a trend in Cape May as to where your responses are coming from, or is it all over?
We cover a broad area. We cover EMS for U.S. Coast Guard, Cape May, West Cape May, Cape May Point, and sections of Lower Township. And there is no area that's any better or worse than anywhere else. A gas station on Washington Street going out of town to a house in West Cape May, it's really not. It really doesn't matter, and it's all ages and all all different people. I mean, we've had youth, we've had people who were in their 60s and 70s, if you can believe that we've actually had to use Narcan on, and that's a scary reality for us, especially, and it should be a scary reality for everybody in this room that it's there, and it doesn't matter who you are.
What, as a parent, what can I do if my doctor or dentist prescribes my child an opioid? What are some effective alternatives to opioids in treating pain? And maybe we'll just go right down the row and see if anybody has a couple quick comments on it. Tom, start with you. Nothing?
I think absolutely. I think there's a lot of things that can be done besides this prescribing opiates. I understand when you're in the hospital, whatever, you're going through some kind of procedure, and you might have to take this medication while you're in the hospital. But I think education to people is very important, because they'll continue to give you them opiates and send you out the door. There's no reason why they couldn't stop them opiates while you're in the hospital and get you out into something else, like some Motrin or whatever it may be, or some different non-narcotic pain relievers.
So as a parent specifically, though, would you try to intervene and, not to question the doctor?
Absolutely.
You would?
Absolutely.
To say, is this absolutely necessary?
I've seen this thing affect people from all walks of life, from Park Avenue to Park Bench, from 5 years old to 90 years old. It really doesn't matter. I've been in rehab with older folks, men and women, that the same type of deal. They were prescribed because of a medical procedure, and the next thing you know, they're addicted to these opiates.
Yeah. It's funny because when I was in the hospital, I said, what's causing the pain? They said, inflammation. I said, why not give me anti-inflammatory drugs then?
Right.
And, wow, the light went on. That would help, wouldn't it? So, but, I want to tie this in, too, with young athletes, high school athletes, especially the young guys, they say, have a higher preponderance, obviously because of the rough and tumble sports, of having sports-related injuries that require some follow-up care, some pain management and stuff. what kind of, processes or education or programs are there to help educate and hopefully let people know about opioid dependency, especially when they're dealing with athletes with maybe some very severe injuries?
Yeah, I think there's a couple pieces to that. One is when you're recovering from an injury, I think that we did have a mindset for a long time, when you would go see your physician, they kind of ask you, where's your pain on a scale from 0 to 10? And I think there was an expectation that pain would be managed to a point of 0. And I think what we're starting to learn is that part of our responsibility as patients is just sort of understanding what is an understandable amount of pain for us to be able to tolerate. Brian says, I'm in pain sitting right here today, but, I'm going to treat it with anti-inflammatories. I'm not going to take an opioid. If you have a significant knee injury, and, I had a nephew that had a significant leg injury, actually had a metal leg put in or a metal bar put in his leg from playing football. And that was the biggest concern we had when he was in the hospital. How are you going to manage the pain? We don't want him on opiates. And it was a conversation that we had to sort of advocate that we wanted him off of, opiates by the time he left the hospital or within a very short period of time of him leaving the hospital, and having an honest conversation about well, yes, you are in pain, but is it a tolerable amount of pain? Is it something you can live with? Is it something that you can tolerate? Is it too much? Because the idea of just medicating everything down to a 0, we've kind of see where that has led. So I think part of it is education of, and I also, I think that the physicians are put in a tough spot. They're graded. Hospitals send out comment cards and things like that, and they have to be held responsible to things like that. And I'm sure that they don't want somebody leaving angry at them because they expected to be in no pain and they are in some pain. So part of it is our accountability with it, and us kind of understanding, our bodies and what's an acceptable amount of pain that we can have while we're recovering. And I think for parents, it is really something that you want to be on top of. You don't want a prescription for 30 days. You want, take it a week at a time. Make sure that your medication is taken appropriately, and then, you want to tricate that medication as quickly as you can.
Mm-hmm. I don't know if any teachers in the room today. I'm sure there's a couple, but I want to thank the teachers for all they do, because a lot of times, more than parents, even teachers and coaches are on the front line of this, and they're going to see the students and interact with them. So, I thank the teachers for their education and awareness of this. Chief, real quick, are there any efforts in Cape May that you know of to provide athletes and their parents with information, opioid addiction from the city?
I don't know of any particulars. I could tell you, my son's a freshman at Lower Cape May Regional, and he's been an athlete his whole life. And we've had the drug discussion so many times, and I've told him too many bad stories, and he understands it. But the one thing, if I can offer anything on that end, there isn't a safe drug out there. I don't really care what anyone says. Marijuana is being laced with fentanyl. That's where we're at in this world, and that's always been one of those fallbacks where everyone thinks, oh, it's okay, I'll just do that. Well, I'm here to tell you that that's probably as bad an idea as doing anything else. So, information, we have it. There's a lot of links that we use. We do training every quarter for our medical director to update, and they keep changing the rules and they keep updating information, and we try and get it out there as best we can. But, I don't know what the city has. I've never actually seen a pamphlet from the city to be given out, but like I said, we have information at the station for anybody that would like it. So
I think what. Okay, Joe.
I was going to say also, the New Jersey Prevention Network created an athlete's toolkit, which talks about alternative pain management for athletes and warning signs that coaches can look for if they think maybe one of their athletes is developing a dependence. I know that New Jersey Prevention Toolkit was administered to all the athletic directors in Cape May County. So they all have that, and I believe that there are 2 trainings that our coaches go to around that toolkit. I think they do one for the fall sports and one for the spring sports.
Yeah, NJPN does a great job. I think njpn.org, I think, is their website, too. Diane Litterer does a great job with that, too. Well, thank you. Just one quick comment. One thing I learned as a parent, and I live in a really nice area, I thought, and my kids told me they had access to cocaine and marijuana as early as 7 and 8 years old. You know, I think of Brian's story, and you know, there is a nice high school full of nice people, and you know, when I heard about it, I just thank God my kids were strong enough and educated enough to know, you know, it's bad for them. Of course, today we're getting all kinds of crazy messaging because it's bad to smoke cigarettes, but it's great to smoke pot. You figure it out. If you can explain it to me, then better than me. Anyway, now we have an opportunity to take some questions from our audience. And today's event is being recorded and I think streamed. So please wait for a microphone on either side of the auditorium here and approach a microphone, any questions you have, and we'd be happy to have the panelists address them. So who wants to start? Please, sir.
Hi, thank you for coming today. My name is Jeff Schwartz. I'm the chef instructor at Lower Cape May Regional High School, and I'm here with some of my students. I have students who have parents that are heroin addicts. I have students who have parents in jail. I have students whose parents are dead. In my personal family, I have 4 kids. One has suffered from drug abuse. He's been clean for 2 years now. I have my 3 others have been super successful. We grew up my family, middle class, upper middle class, say no to drugs, the whole story. Lower Cape May, I lived in Upper, Lower Cape May Regional, our students suffer from 43% poverty. We practice the resiliency. I think Cape May County is in the top 2 or 3 of everything that could be, for the most part, considered negative. Besides the poverty, drug abuse, alcohol abuse, domestic abuse, senior citizen abuse. Knowing doctors down here and knowing that the drug healthcare industry in Cape May County is struggling. I believe there is 1 psychiatrist on staff for the county, for this whole area. I know that physicians that I'm friends with are diagnosing young people because they can't get the help elsewhere. There's a waiting list for detox, unqualified, burnt out healthcare workers down here. So my question is, and we practice resiliency in school and such, and I think we do the best we can with it. But I don't see changes. I think it's getting worse. And everybody can talk a really good story, but it's getting worse. So tell me what else is going on. Whereas we, as members of the community, can even do more. Because the broken families, which are significant down here, and I have students here that are getting through that. But the struggles down here, as was mentioned, with the economy and such, unemployment, that cycle is going to continue.
So you're becoming like a primary care provider at the most urgent level, aren't you?
It's funny because I have students that come down and hang out with me because they feel safe with me and feel comfortable. And I've always been, kind of like, I don't want to see anybody type thing, but I've been I enjoy that role now. And I take it personally to make sure my students succeed as well. So to a degree, yes. But
And I just want to thank God for educators like you. Before the panel answers, I just want to say how great it is, and I thank the freeholders for being here, the mayor, the elected officials, the appointed. You're hearing this, and this is obviously concerned, so I know you're going to take it back and hopefully address this at your level where you can probably do some good. But I thank you for that question. And who wants to, that's a great question. Who wants to take the first crack at this one? Joe? Brian?
Yeah, I mean, this is something that really touches home because I understand exactly what you're saying. But the things that are being done, different things that are being done, I can speak for what I do and what I see things happening in our community. I have seen a lot of programs start up with the Hope One, getting out in the community, reaching out into the community. I've seen Cape Assist doing great work, the prosecutor's office great work. I mean, the freeholders. We've been having meetings now, me and some local people that are in the field of trying to get some things started down here, like an outreach center for people that are in recovery, people that are trying to get help. But what it all does, it all takes time, it all takes people, and it takes money. And we've been pushing and trying to find a place to make this happen. And really, it's difficult because there is people here, and there's people here that understand that it's in our community, it's in our backyard. But when we go to do something about this, everybody wants to say, "And not in my backyard." They don't want it. They don't want it next to their houses. They don't want it next to their buildings. I own a sober living house. I house 16 guys right here in Rio Grande, in Middle Township, which is new. That's a year and a half old. I've been pretty much full since I've opened. There's a women's house. So there is things happening in our community. It's just been a difficult road, just like, I mean, you can see, like, trying to get help. And Joe here talked about it. You know, if people don't have insurance and there's not beds readily available, you know, we have to find something else. We have to find a different route to go. So there is definitely things that are happening in this community. It's just getting to that point. And really, it's very important to raise the awareness of our people in the community and let them know, like, there is alternative programs. There's Al-Anon, there's Alateen, there's AA meetings, there's NA meetings, there's different kinds of groups, there's group therapy, there's things for different teens, programs at Cape Assist, Cape Counseling, and Family Matters, and places like that we can get kids signed up for and get them in there. So there definitely is. There's a lot more help now in this community and in this township than there used to be. So we are making great efforts, and but once again, it does take people in the community, and it takes it takes money, and it takes a place to make this happen. So that's kind of the stuff that we've been struggling with, and we are pushing. We are definitely pushing along to try and make this kind of stuff happen.
So, and I'll just kind of say, if you ask, what it is that we could be doing, it's what you're doing. Jeffrey Buckholtz, I'll steal this. He's a violence prevention speaker, but he sort of says, like, if you want to take the problem with ACEs or trauma or drugs in our community, he says, I want you to visualize it as a giant brick wall. Says it is a huge, giant brick wall, and it is right in front of us. And all we have to do to solve this problem is we have to take down that wall. Says, but this is the question. We look at that wall, and we all think to ourselves, get me the dynamite, get me the wrecking ball, get me the bomb that's going to blow it up. And that's not what we get. We all get a chisel. And that's the only way we take down the wall. It's for each one of us in this room to pick up a chisel and pick away at that wall. And I know that that's long, and it's a lot of work, and I know it's frustrating, and it's exactly what you're doing by being a trusted adult to those kids. So those kids know that there is somebody in their community that cares about them. And that's so important. And even if it's only 5 kids, you're making a difference to those 5 kids. But we all have to make that difference. We all have to help the person in front of us, because it's not going to be one program. It's not going to be Hope One's not going to solve all of our problems, or another sober living house isn't going to solve all of our problems, or a rehab in the county is not going to solve our problems. No one's going to solve this for us. We have to solve it. We all have to just do that one piece. We all have to care about, the youth in our communities. We all have to just do what we can to provide safe and healthy things for kids to be a part of, to let them know that they're valued and we care about them and we want them to grow up happy and we want them to grow up successful. And it's all of those little things that each one of us is going to do. And unfortunately, that's the only way we're going to take down that wall, is each one of us picks up that chisel and starts hammering away at it.
Thank you, sir, very much.
If I could just add to that,
Tom?
I think part of that is happening with our ACES project. What started off as a group of 5 has expanded to a group of over 60. And rather than work in silos, we're working together, like Joe just said. And I think if we do work together, we can make a lot more progress. We're not trying to all do our own thing. We're trying to do what's out there already, bring it together, and give knowledge to the community what some of the resources are in our own community.
And from our standpoint, broadcasters, we do a public education program, and we try to get the word out about this. But there needs to be more outreach. There needs to be more resource sharing and awareness of the resources, too. So thank you very much. Yes, ma'am. Oh, I'm sorry. Were you next? I apologize. All right. How nice. Go ahead, please.
Hello. It's great that you're here today. It's very nice. My name is Alexandria Boehm. I'm 17 and a senior at Cape May Tech. I'm in the travel and tourism program. And it is great that I've had an opportunity to come out of school today and see this and learn about opioid abuse. The thing is, in our schools, we see people who are on drugs, who are addicted to drugs, and sometimes they don't realize that they have a problem because we are not receiving the education about this at all.
Yeah, no, and thank you for pointing that out.
Yeah, and this is a great program. I love that you're going to every single county, but what are we doing? My question is, what are we doing to bring this education to the schools? I'm so lucky to have 2 teachers that talk about this and that have brought this aware, but at the same time, this is not a school-wide thing. I'm lucky that I'm in the travel and tourism program and I've been learning about this. But there's kids overdosing in chemistry class. Like, what are we doing to help these kids?
Well, I tell you, first of all, thank you for being strong, because it's not easy being a kid today. And I thank, again, the teachers for being there to help. You're a good success story, but we are failing in so many other ways. And I don't know who should address this first, but maybe Vicki, go ahead. This is a good question.
Thank you so much for standing up and sharing how you feel about this, because it's so important to hear from you. And I think you represent the voice of so many students that are here today and students who are not here today. And I think that you represent a situation that is out there because substance abuse is so common. It is a crisis. And that is why we are really here today, because it has become a crisis, and it is so common that we think that we don't have to talk about it because everybody knows about it. And I think that is one of the reasons that it is so commonplace that everybody thinks we know what to do about it, but nobody does know what to do about it. And nobody is talking about it, and it is everywhere. Probably everybody in this room, if you have not had someone in your personal family, you know of someone in your that has a personal family member or a close friend. I have a family member who was a drug addict and went to jail. He had charges brought up against him by a family member, and it was heartbreaking. It tore that family apart, and his drug abuse led to a health crisis that cost him his life at a very early age. And I really believe that everybody in this audience, one of the reasons that you're here today is because you have a similar story that you can share. And one of the reasons that the Chamber is involved in this is because we had someone at a meeting, a speaker, that was talking about what is happening to children One of the statistics that Tom was talking about that is a factor in adverse childhood experiences and the things that ranks Cape May County so high is the number of children in out-of-home placements. And we had a speaker talking about that, children living in foster care. And afterwards, I had several people come to me and say, why is the chamber talking about something like this? It made them very uncomfortable. And the number one reason that children are living in out-of-home placements is because of substance abuse. And it made these people who came to me and talked to me and said, why is the chamber talking about this? This has nothing to do with business. But that is, it is a very important effect on people's ability to go to work and focus on their job, because they're worried about their families, they're worried about their children. If it's not their own children, it's about children that they love and they care about. And it's causing them to be called out of the workplace and deal with these family situations. And it hit me like a ton of bricks. And I thought, I've worked for the Cape May County Chamber of Commerce for almost 30 years. And for those 30 years, we've been talking about our problems with workforce development and how our businesses can't hire people who can do the jobs or be trained to do the jobs, or we can't find people or keep people or whatever the problems are. And if we had been addressing this problem for those 30 years, would we still be having this conversation today? And I thought, we're not going to continue to kick this can down the road. And it all comes together full circle. And maybe today the issue is opioids. But if not opioids today, what's the drug going to be tomorrow? And what was it yesterday? And it begins with our children. And so I'm so sorry that you're dealing with this in your classrooms and in your school and with your friends and with your family. And I hope that you can take back some of what you've heard here today and say, you know, let's have these programs in our school.
And I most definitely will.
Thank you.
Thank you very much.
I just want to,
Brian?
I just want to touch on that for 1 second, and I greatly appreciate the young lady coming up and sharing that with us. And my hat goes off to the teachers that step up and do that, because a lot of people are just too quick to, not my problem, you know. So my hat goes off to you. But you know, and one of the things that she said was they don't even see that they have a problem. And I got to tell you, for myself, you know, there was nobody there. You know, there was no kids. Nobody wanted to step up and, you know, really say anything to me. You know, and when it got to that point and they did, it was like, I'm okay. There's nothing wrong with me. You know, because what happened was the abnormal became normal. You know, so at home and in my neighborhood, I was already seeing all this stuff. So I was just kind of like doing what everybody else was doing, was what I thought, you know. So when you see, you know, a young kid in school, I mean, it kind of breaks your heart, ODing in chemistry class. That's a problem. That's a problem. You know, so really, I mean, the programs now with you know, with reaching out and with to the kids and educating the kids is very, very, very important. You know, I know for myself, like, I had to go through so much, you know, to get to the point for it be enough to wake me up. My last time that I took an opiate was the last time I used. I went into convulsions and I seized out for hours in the parking lot of North Cape May when the cops arrested me. You know what I mean? And that's kind of what it took for me. Was that my bottom? Was that the worst thing that ever happened to me in my life? Absolutely not, but that's what it took to wake me up. And sometimes that, you know, it takes certain things for people to get to some kind of point to see that they have a problem. I just took my little brother. I got a little brother. He's a doctor. He just graduated grad school from, he just graduated Drexel. I took him to a meeting, an AA meeting, about 2 weeks ago. He's been having a problem drinking and going off the deep end. And he went to a meeting. I mean, bad things have happened. I won't get into all that stuff. He was down over the weekend at my mom's house in the Crest, and he was plastered. You know what I mean? He's got his whole life. He just got a job, You know, he's got his whole life ahead of him. What makes us do the things that we do? You know, they say that the disease of addiction is centered in the mind.
Sure.
You know, so it takes, recovery is about an active change of attitudes and behaviors. You know, and it's about changing that thinking. So really it has to get to the point where we educate people and change that thinking.
And I think also getting the thought leaders in the different communities, especially in schools, and the young people. I mean, we're an addictive species, okay? Whether it be gambling or alcohol or drugs or all kinds of things. Look at vaping, right? Everybody's vaping now, and now we find that that's bad. But until a couple days ago, that was a good thing. I think it's what you're saying, Brian, is that everybody has a role to play, and it's not just one thing we do, it's everything we do together. And these roles are in every aspect, in every walk of life, every strata of life, every age group in life. And I think we've got to keep that top of mind as well, because this is a big problem. It's not going to go away if we just have these nice forums and then go home and do nothing about it. So I agree with that young lady very much. Joe?
I will also say this is something youth need to get involved with as well. When I first started at Cape Assist 13 years ago, my first job was I was a youth coordinator for a program called Rebel. It stood for Reaching Everyone by Exposing Lies. It was a youth anti-tobacco club. And basically what we did is we empowered youth, and we said, Big Tobacco has been targeting you guys for 40 years with their lies and their poison. Go target them back. And over the course of 10 years of Rebel, youth smoking rates decreased every single year. And the passion and the energy and the ideas that came from the youth in our county was amazing. And those opportunities exist today. Temerity, in the back, there's Temerity Berry from my office. She runs a youth opioid task force, which gives youth in our county an opportunity to take a stand in this fight against opioids, to make a change in their community and to help the person in front of them. So if I urge all of the youth in the room today, be a part of that. Be a part of making that positive change in your school.
Great. Question.
Hi, my name is Lauren Bowersock, and I'm 22 and grew up in Upper Township and went to Ocean City High School. Hi, I just wanted to say that it's inspiring what you guys are all doing on all different levels to address this crisis. I just received a bachelor's in sociology at University of Maryland, and I'm now in a Master of Social Work program at Rutgers. And work as a family support worker in this county with Healthy Families, my two coworkers over there. And we serve families that are struggling with substance abuse and poverty and homelessness and all different things. And one of the things that I've taken from my education and experiences is that the issue is multiple levels. It's not just one thing isn't going to change it. I think for a while, we looked at substance abuse as like an individual issue, like an issue of individual morality. Like they're a bad person, they're an addict, they whatever. And now I think it's wonderful that we're looking at it as like in the context of adverse childhood experiences, because we're realizing it's not just they're a bad person, they made that call. It's they also had trauma and they went through all of this. Sorry. So, but one of the things that I don't know if I've really seen be totally addressed is the issue of year-round employment and fighting poverty. And I really appreciate that there's the focus on prevention, there's the focus on treatment, there's the focus on like so many different aspects. But I want to ask, what are some things maybe that we could do to increase year-round employment in Cape May County? Because I do think that poverty is a root cause, and if you don't have enough money to afford your bills and afford year-round housing, there's not a lot of affordable housing here. I try to help my clients find housing all the time, and it's really, really depressing to try to find something that they can get on a minimum wage job or even a little more, like higher, like there's nothing, and to not know where you're gonna live, to not be able to afford food. There's probably like over 30 food pantries in our county, and hundreds of families are relying on that to eat. And so I guess the only thing that I've heard as a possibility to increase year-round employment is there's a proposed medical marijuana facility coming to Cape May County, possibly. And I've heard that as a proposed way to add jobs to our county. I don't know how I feel about that because I know medical marijuana is different, but it's like adding more drugs and whatever. So I don't know if the chamber or if any of you have any ideas of how we can increase year-round employment in this resort seasonal town.
Yeah, Vicki, before you answer, I just want to say one of the things I've noticed, and this works, it's tough living in the Northeast. It gets cold out. But, in Florida, in the summertime, they have the same cycle that we go through, and everybody's trying to attract business. One of the things I've noticed in our shores in Jersey is that people are doing more, and the mayor and the chamber, you're having Oktoberfest, you're going into, you're trying to expand the season. The season was contracting for many years, but now we're trying to expand it, doing things like film festivals in May and early and late April and keeping the season going. But I guess we need the chambers and we need the business community, the people in hotels and businesses to try to find ways to attract people to come down here year round. But that's a big challenge because the other problems don't go away. Right. What happens now if, who can afford a $10,000 a week oceanfront house all year long?
Right.
So this is a big problem. Vicki,
so
God love you. Let me hear this one.
Well, I'll touch on it, and I'm sure the other panelists will have something to add. So year-round housing is an issue. That is part of the problem. But for year-round employment, many of our businesses and organizations have worked very, very hard to expand the season and have been successful in doing that. That's not going to equal the power of our beach and boardwalk summer-driven tourism economy, which is huge. And our freeholders are here, and I'm sure they would love to add to the conversation of what they are doing to build the UAS or the drone and technology industry, which has the opportunity to add some significant jobs in that industry, which will be year-round jobs. And that will take time to build, but that also has the opportunity to really add to our economy. And there's development of the Tech Village going on at the Cape May County Airport right now. But that's going to require that our local workforce seek the education and the training that's going to be needed for those industries. And also we have to step up as a community as well. And we have to get off of the unemployment lifestyle of working 4 or 5 months and going on unemployment. And I only bring that up because that is a problem, and I know that there are some employers in the room too who have a very hard time filling year-round positions of mechanics and in front desk management, and they are hiring and filling those positions with people coming from out of county because of the generational habits that we have had. And so as a community, we really need to lift ourselves up as well. And we need to realize that if we want these things, we have to be prepared to change our lifestyle and our habits for these things as well. The pay scales will come, but it is a give and a take model. And we work towards them and we help build them with the employers. It takes a while, it takes a process. I think what's happening with the Kmart facility and that development is going to be a beautiful addition to the county, and we'll look forward to hearing more about that as well. But I'll let my other panelists add to the conversation. I think there's some things going on in healthcare that might add to it.
Again, we struggle all the time with trying to find qualified people in healthcare to work for us, and that's one of the things we face the same issue that Vicki does. We sometimes have to go out of the area to recruit people to work in our, so we need to, as a community, look at how can we bring our people that are currently here up to the standards of being able to work some of the professional jobs that we have to offer.
Okay. Well, we have time for one more question, and I got to know, what is this gold band? What's that mean?
My name is Eddie Oakley. I coming from Cape May Tech. I'm a senior, and I was invited by the hospitality group as a representative of the National Honor Society. There are 2 of us here today, and I'd like to thank them. I'd like to thank you guys for the invitation for our school and just the amazing experience and input, and now how I can see various perspectives on the opioid crisis around the county, around the state, even nationwide. And I'd like to ask, I'm an athlete. I've run cross country all 4 years of high school, and I'm currently a captain. But looking back, my freshman year, I knew a kid. I'm not going to name him, but he was a senior at the time, and he ran cross country. He was very, very good at it. And I'm looking back now, I think he had a problem with opioids and painkillers, because every day for practice, for actual meets, he would be taking painkillers before he'd even run. And he'd be telling us as a team, he was like one of our higher runners, he'd be telling us he can go out and he can run a meet. He'd take these painkillers, he wouldn't feel a single thing. And I'm looking at it now, I'm seeing, well, that's not a good thing. If you're taking all these drugs and you're not feeling a single thing, there's something going on. You're going to enjoy that. You're going to become addicted. I'd just like to ask you guys, what are better methods for pain relief? Obviously, as an athlete, you're never going to completely eradicate pain, whether or not it's day-to-day just soreness or it's a major injury. But where can I, as a captain or as an athlete, go to for resources to see better methods to relieve pain, to avoid becoming addicted to opioids? And how can I help my fellow teammates, my fellow students, just figure out better ways to cope with pain?
Well, thank you. I appreciate your question. I appreciate your leadership and your achievement. Believe me, I didn't make National Honor Society, so I admire what you did. It's great.
Thank you.
And thank you for the way you're caring about, as a leader, caring about your fellow, men and women under your leadership. So that's terrific. Stepping up. Great question. Who wants it? Chief?
Yeah, I'll take a shot at that one. I grew up. I was a baseball athlete. I played baseball most of my life, and I've surfed my whole life. And because of my job, and it's just the nature of the beast, I have lower back issues now from lifting people and equipment and things like that. So pain management sometimes can be a bit of a stretch. I've coached baseball for many years, and I can tell you from T-ball through Little League, when we talk about pain management with kids who get injured, we never recommend anything other than rest and physical therapy. And for an athlete who's competitive, and I can tell you, when I played baseball, I was a redshirt freshman pitching, and I dealt with elbow issues. And my father was a retired police officer. He was dead set against that stuff, and my mother was dead set against anything other than maybe a Tylenol from time to time. But if I had kids that were injured or had pain, I wouldn't play them. And that's difficult for a young athlete to be told that you're not going to play and compete, especially at the high school level when you're looking further into the future. So from my perspective, just as a human and a parent, I would just have to say that rest and therapy over anything else will help. I mean, you hear ice this, we always hear the parents say, "Oh, I got ice, I got ice." It's always a joke in the baseball league when somebody gets hit by a pitch until you get hit by a pitch, and it's not funny anymore. But I would have to say that, I mean, for me, that's my perspective on it, that you treat your body well without putting chemicals in it to solve a problem.
And I would agree with that. We have a tremendous physical therapy program throughout our county, 4 different locations, but we see lots of student athletes, and physical therapy is a much better alternative than drugs. All the drugs is doing is hiding the problem. Physical therapy is fixing the problem. The most difficult thing for a student athlete, though, is hearing the words, you can't participate for 3 weeks or 4 weeks, or maybe even out for the season. But the long-term effect is going to be more positive than the short-term of missing that season. And I know it's very difficult when you're trying to be at the top of your class so that you get the best scholarship and everything else. But look what's happened to some of our athletes today who are basically crippled at the age of 35, 40 years old because they didn't take care of their body the proper way. So I strongly would agree that physical therapy is the best approach. Go to your doctor and get the right care, because the drugs are just going to hide the problem. They're not going to improve the problem.
Anyone else?
I would just say also be preventative about it. You know, one of the things that some of our athletes might not also understand in terms of underage drinking is the youth that are going to utilize alcohol, you're going to be more prone to soft tissue injuries. Alcohol dehydrates, and because of that, you're more likely to get muscle pulls and things like that. So, you know, just keep that in mind as well. You have to be preventative about it and how well you're taking care of your body while you're training.
Great stuff. By the way, I was just texted by Angela. The partnership desk back there has some resources for you that you might want to pick up, okay?
All right, thank
So
you,
make sure you
guys.
check it out. Thank you for coming up. Thanks for stepping up. Well, my producers just told me we do have time for one more question, so you get to be the last question, sir.
That may not be a great idea. My name is Bob Boyd. I'm a retired police officer. I did 30 years as a police officer, and I've done an additional 16 years instructing at the local police academy. That's just a kind of a background. I've been with the old days, and I'm with the present days. And I commend law enforcement today for deciding that we're not going to beat the drug problem by arresting people. The answer is to go into a treatment in a co-op. But that's the present. I'm going to ask a question about the future and get a little personal about my own experience here. I have 7 great-grandchildren. 3 of them are the victims of substance abuse. I have a grandson who is having a great deal of difficulty in learning disabilities because he's a victim of fetal alcohol syndrome. His mother decided to party while she was pregnant. I have a great-granddaughter in Georgia who I will probably never see again because the state of Georgia has a way of dealing with mothers that don't want to quit using drugs while they're pregnant. My great-granddaughter was born addicted. Her parents were active addicts. The state of Georgia simply removed that child from her parents and put her into an adoptive program where she is now and experiencing difficulty because she was born addicted. I have a young grandson, great-grandson, locally. Mom was on a methadone program, which she didn't discontinue while she was pregnant. My great-grandson was born a methadone addict. 3 innocent victims. These are young children. We have no idea what the future holds. And this only just one, that's me. I have 3. We have no idea what the future holds for all these young people as they get into the school system and they become disruptive and they have learning disabilities. And I noticed that I've never seen a program where is anybody following up anything we do for children who are born addicted and where they're going to go once they progress in their lives.
Well, thank you, sir. Thanks for your service as a police officer. Well, this is all these questions are really great, really tough, and I'm glad I don't have to answer them. Who wants to answer this one?
Well, I mean, I'll do the best I can, I guess, with it. I think, unfortunately, what we're seeing with adverse childhood experiences, kids who are born with trauma, and what we see with kids who are born addicted and suffer from fetal alcohol spectrum disorder, because of the physical ailments that they have, it leads to behavioral issues, and those behavioral issues have a tendency to lead to lifelong problems, which then makes them more prone to become substance abusers themselves. And I think that it really brings to light, more so than anything else, that in what we're doing here, there are no perpetrators, there are only victims. And it's cycle of victims that are creating new victims that will go on to create new victims. And it is overwhelming when we think about it, but it's only through the work that we're doing with ACEs. It's only the work that we're gonna do knowing that we have children that are born addicted and surrounding them with services, helping to foster resiliency, helping to meet their learning needs so they can thrive and be successful and put trusting relationships around them, I think is the only way we're ever going to be able to break this cycle and move forward. But I think that when we kind of wrap our heads around the fact that in what we're dealing with in this opioid epidemic, there are only victims. There are no perpetrators. Then only then do we sort of have the understanding of how we need to help the people in front of us and do everything we can to surround them with the services and the things that they're going to need to be successful so we don't continue to perpetuate this cycle.
One of the things we're also doing is we're now working with our local pediatricians on the whole ACEs project so that we can identify the issues at a much earlier age and hopefully be able to interact so we can break some of that generational ability that's taking place. And hopefully eventually we'll be starting to work with moms before they even have children to make sure that we break that cycle even quicker than we did with than we're doing now.
But as it stands now, there is no real follow-up. We don't have any kind of a record of how many children we have that are born addicted. Is that correct?
We have estimates on how many children are born from fetal alcohol spectrum disorder. It's a pretty staggering number. I believe, I don't want to misquote it, but I think it's almost 1 in 10, and the cost to us as a society is close to $5.5 billion a year of children being born with some sign of fetal alcohol spectrum disorder. So it is a growing problem. It is a very big problem. And which is why our response to it has to be to help support these children so that we can break the cycle.
Great, Joe, thank you very much. Thank you, sir. Well, you know, Chief, one quick question. Where are the drug drop boxes in Cape May that we can
They're
point out?
actually at the Cape May Police Department, 643 Washington Street, right in the lobby. They have one in there. We don't currently have one at the fire station. They have a more secure location.
That's great, and you know how that works, so just drop them off. Okay, one quick question. We came here to learn. If I could get a quick question answered from our panelists. What have you learned from interacting with the audience today, and what specific action item might you consider as a result of today's discussion? Tom?
I think it's encouraging to see a group like this today that's come out and asked the questions that you're asking, to be interested in the problem that we have here. Most encouraging is seeing our students out here. They're the next generation to be making decisions, and having them hear this information, deal with this information, hopefully when they're in that decision-making capacity, they're going to help make and be a part of the change, because the only way we're going to make progress is to change what we're currently doing.
Thanks, Tom. Ray?
Yeah, I agree with our friend here, and you know, I just really appreciate, you know, the kids from school coming out, you know, and the gentleman that just asked the last question was speaking over there, you know, with the kids and you know, the grandkids and stuff like that, and that stuff really hits home with me, you know, and you know, you see a lot of people, and you have kids that are acting out, you know, at a very young age, and what people's first reaction is to punish them, is to yell at them, is to scream at them, whatever it may be, you know, because whatever's going on in our lives, you know, maybe we're caught up, maybe we're on unemployment for the season, you know, and we're just caught up in whatever, and the kid is being neglected, you know. At the end of the day, I have a 5-year-old at home, and I'm going to go home and hug him, you know, and I just really appreciate you guys allowing me to sit up here, and it's a true honor and a privilege. Thank you.
Thank you, Brian. Joe?
I think a couple things. One, I'm always overwhelmed when I see the support of our community. The fact that all of you would come here at 9 o'clock in the morning on a Wednesday to a town hall meeting on opioids, I think speaks volumes to how much you care as a community. And I think that that's really overwhelming for me. You know, I work in a small agency with 15 people, and sometimes I feel like I'm the only one chipping away at that wall. And it's very motivating for me to know that there is a community here that cares and wants to help people. So I thank you all for that. And I think the second thing that I really take away from this is we need to empower our youth. They are the ones who are in our high schools with kids who are struggling. And the same way 20 years ago we empowered youth to take a stand against big tobacco, we need to empower our youth again to make a positive change in their school and to help their fellow students that are suffering.
Vicki?
Well, I echo everything that's been said, but I think it is just the fact that no one is really dealing with this problem on their own, but we are one part of a larger community working together to bring about a solution that's affecting everyone. So, I'm just very proud that the Chamber has brought the business community into the conversation, and I think that we were too slow to get involved, but we're very proud to be here.
Glad you're here now.
Thank
Chief?
One thing I'd have to say, I have to reiterate everything that was said. The community support is something huge, and from the emergency medical end of it, it's heartbreaking what we have to see. But I've always been aware of what goes on, and I can tell you I have a son in high school and one and a daughter in elementary school, and it's scary for me to see that things are going. And hearing some of the testimonials from today as to what has been witnessed in the classrooms in the schools is painfully disheartening to me, and I really hope that's something that can be taken care of. We have gone so far on the fire and EMS end of it. It's Fire Prevention Month, as everyone knows. We go classroom to classroom at the local elementary school, and we've changed some of our program to address this stuff when we start talking about 911 and things like that. And to go from, all the stuff you learn in fire prevention, stop, drop, roll, and all that stuff, to, oh, by the way, that just kind of goes to show you how it's changed in our world, and that's a scary thought also. But like I said, I have to reiterate what everybody said. I mean, it's great to see the local community coming out.
Well, thank you. I know I've learned so much today, too, everything you guys taught me, but I think I learned the most from those students. We've got to do more to get in there and help these guys. Well, thank you all for joining the conversation here today. I hope that today's discussion has inspired you, as it has me, to make a difference in your community in this crucial fight against the opioid epidemic. Governor Murphy declared October 6th as Knock Out Opioid Abuse Day. As throughout the state of New Jersey, Knock Out Opioid Abuse Day will help increase understanding of the opioid crisis through a mobilization effort with a dual focus, educating physicians and raising awareness among New Jersey citizens and families. Last year, more than 10,000 volunteers statewide helped spread the message about the dangers of prescription opioids and educate their fellow community members on the severity of the opioid crisis. There is a great community opportunity here for you to take action in your own communities. Each of you has been given a package of Knock Out Opioid Abuse handouts when you came in. By distributing the material in that package, you can help 25 of your neighbors, friends, or coworkers learn about how to prevent opioid abuse in less than 10 minutes. You can prevent, educate, and raise awareness and be a part of the solution to knock out opioid abuse. Additional information is available at the tables, and resources are available on the event website. And please complete your survey and return them as you leave. You can enter to win an Apple Watch by completing your survey. To all our panelists, to everyone here that is in the fight together, thank you so much for being here. God bless you and safe home. Have a great day.